Seniors, beware. 9 popular medications that can trigger rapid dementia. The silent, insidious march of cognitive decline is a terrifying reality gripping our aging population, and an estimated 20 seniors will receive a devastating dementia diagnosis by the time you finish this vital message. That's one individual every 66 seconds facing a future overshadowed by memory loss. What truly demands your immediate attention, however, is the shocking truth. This isn't always the inevitable hand of time. The real enemy might be hiding in plain sight, right inside your medicine cabinet, in the very pills you trust for your well-being. We are often reassured these prescriptions are benign, routine, even life-sustaining. Yet groundbreaking research is now tearing down these assurances, revealing a terrifying secret. An astonishing 99% of seniors are completely unaware that at least one medication they take daily could be actively shrinking crucial memory centers in their brain, leading to a staggering decline of over 28% in less than a year. Let that chilling statistic truly resonate. This isn't just theory, it's a grim reality witnessed in countless lives. Your future, your cherished memories are on the line. You won't want to miss the final habit, or 99% will miss the last tip and will be stuck with rapid cognitive decline and memory loss for life. Pharmaceutical giants have known about these detrimental effects for decades, yet continue to rake in billions by selling the very drugs that could be accelerating cognitive decline in millions of seniors across the nation. A pivotal 2023 study highlighted an alarming finding. One specific class of medications was linked to a breathtaking 49% increase in dementia risk among seniors within a mere 2 years of regular use. This isn't a small statistical blip, it's nearly a 50% amplification of the typical risk, a ticking time bomb for your brain health. We are about to meticulously unveil the 9 most dangerous medications actively triggering rapid memory loss and dementia, ranked from those most commonly overlooked to those with the most devastating cognitive impact. Prepare yourself, because number 3 on this list is a drug prescribed to millions for seemingly benign ailments, yet it possesses the alarming capability to shrink vital memory centers in your brain, and you may not even realize it's affecting you right now. Ignoring this crucial information could mean losing pieces of yourself day by day without ever knowing why. This is your chance to reclaim control over your cognitive future. Do not underestimate the danger of our first revelation, for it is a medication found in nearly every senior's medicine cabinet, potentially impairing your cognitive function even before you notice the initial subtle symptoms. At number 9, we encounter diphenhydramine, more widely recognized by its common brand name, Benadryl. This familiar pink pill is a household staple for millions, trusted for its ability to induce sleep, alleviate the torment of seasonal allergies, or offer swift relief from common cold discomforts. Its accessibility and affordability are undeniable. It's readily available over the counter at any pharmacy, and it's highly probable that a bottle resides in your nightstand or bathroom cabinet at this very moment. You might believe you're simply using it for a better night's sleep or to manage a runny nose, but the reality unfolding within your brain is far more deeply concerning and potentially irreversible. Benadryl doesn't just make you drowsy, it actively disrupts the hippocampus, a critical region of your brain that is the very engine for forming and consolidating new memories. This means your ability to learn new things, remember recent events, or even recall conversations from yesterday is systematically being sabotaged. Diphenhydramine belongs to a treacherous class of drugs known as anticholinergics. These medications function by cruelly blocking a crucial neurotransmitter called acetylcholine. Acetylcholine is an indispensable chemical messenger, the very spark that ignites your brain's capacity to create new memories and maintain alertness throughout your day. As the brain ages, it becomes increasingly reliant on every last drop of available acetylcholine. When medications like Benadryl interfere with this delicate, vital process, the consequences can be profoundly devastating, stealing your cognitive clarity piece by piece. Extensive clinical analyses have revealed a terrifying truth. Seniors who regularly used anticholinergic drugs exhibited a 54% higher risk of developing dementia compared to their counterparts who actively avoided these medications. This isn't a minor bump in risk. It represents more than a 50% increase over the baseline, stemming from the regular consumption of what most individuals perceive as a harmless sleep aid. Imagine, your nightly attempt at peaceful sleep could be slowly eroding your future. So, how can you effectively protect your precious memory from this silent assailant? The paramount advice is simple. Steer clear of any product containing diphenhydramine, particularly those deceptively labeled with terms like PM, nighttime, or allergy relief. These formulations often contain Benadryl, discreetly rebranded to appear benign. If you are currently relying on diphenhydramine for allergy relief, there is urgent good news. A multitude of newer non-sedating alternatives are available, such as loratadine, commonly found under the brand name Claritin. These modern antihistamines are engineered differently. They do not cross the delicate blood-brain barrier and are considerably safer for long-term use in seniors. While it is never advisable to discontinue any medication abruptly without professional medical guidance, it is equally crucial to shed the dangerous assumption that over-the-counter automatically equates to safe for your brain. Your brain deserves more protection than a simple trip to the pharmacy. Act now, before another memory fades. Moving on to number 8, we uncover a medication often marketed as gentle and non-irritating to the digestive system, yet it systematically interferes with the very nutrients your brain desperately needs to remain sharp, vibrant, and healthy. This medication class is proton pump inhibitors, PPIs, with specific examples including omeprazole, Prilosec, and esomeprazole, Nexium. These powerful drugs are designed to ruthlessly reduce stomach acid production and are frequently prescribed for conditions such as heartburn, GERD, and acid reflux. Many seniors find themselves trapped on these medications for extended periods, sometimes for years or even decades, due to the immediate uncomfortable return of symptoms upon attempting to cease their use. But this immediate relief comes at a hidden, devastating cost to your brain. A critical, rarely discussed aspect with patients is how PPIs significantly impede the absorption of vitamin B12. Vitamin B12 is not just important, it's an absolutely essential nutrient, a cornerstone that plays a vital role in protecting delicate brain tissue and supporting optimal memory, function, sharp concentration, and stable mood. Without it, your brain literally starves for the fuel it needs. A landmark study meticulously analyzed data from over 73,000 individuals aged 75 and older. The researchers discovered a terrifying correlation. Regular PPI users had a 44% increased risk of developing dementia compared to those who did not use these medications. This means nearly half of all users face an elevated risk of losing their cognitive faculties. By excessively suppressing stomach acid, PPIs disrupt your body's natural, crucial capacity to absorb not only vitamin B12, but also essential minerals like magnesium and calcium. These minerals are fundamental for neural transmission and proper brain cell signaling, acting as the wiring system for your thoughts. In the absence of adequate levels of these vital nutrients, your neurons struggle to fire efficiently, leading to misfirings, debilitating confusion, and memory lapses that often closely resemble the early, terrifying warning signs of Alzheimer's disease. But the problem, tragically, extends beyond mere nutrient depletion. PPIs have also been scientifically demonstrated to elevate levels of amyloid beta plaques in the brain. These are toxic proteins that actively disrupt normal brain function and are considered one of the primary drivers of Alzheimer's disease progression. The excellent news, a beacon of hope, is that far safer and highly effective alternatives exist. If you are using a PPI daily, it is imperative to consult with your physician about the possibility of gradually tapering off this medication. Support can often be provided with H2 blockers like famotidine, known by the brand name Pepcid. While not entirely without potential side effects, H2 blockers are significantly less likely to interfere with cognitive function. Additionally, Chewing a small amount of deglycerinated licorice, DGL, can offer profound stomach lining, soothing, and symptom relief without any detrimental cognitive impact. Don't let a simple stomach issue steal your memories. Take action now. Next on our list, at number 7, is a medication frequently prescribed to manage embarrassing bladder control issues, but which may in fact be wreaking silent havoc on both your short-term memory and emotional equilibrium. This category encompasses anticholinergic bladder control medications, with oxybutynin, commonly sold as Ditropan, being a prime example. Oxybutynin is often prescribed to seniors experiencing the frustration of urinary incontinence or an overactive bladder. On the surface, it appears to be a practical and immediately beneficial solution, as few individuals wish to contend with the embarrassment or inconvenience of frequent and urgent trips to the bathroom. However, the mechanism by which this medication operates involves blocking acetylcholine, the very same critical brain chemical that is mercilessly disrupted by Benadryl, the first drug on our list. Unlike some milder anticholinergic medications, oxybutynin readily crosses the blood-brain barrier, directly infiltrating and impacting the memory-associated regions within the hippocampus. This characteristic renders it particularly perilous for seniors, especially when used over prolonged periods, where the damage can accumulate unseen. A comprehensive study observed that individuals over the age of 65 who took potent anticholinergic medications like oxybutynin for more than 1 year exhibited a 49% higher risk of developing dementia. This means nearly half of the users in this category faced an elevated, life-altering risk. What amplifies this terrifying concern is that the vast majority of seniors are never adequately informed about these serious, profound cognitive side effects. They are simply told the medication will help manage their bladder, not that it may be accelerating mental decline with each and every dose. The cognitive harm is frequently tragically misattributed to the normal aging process. Patients often report experiencing a bewildering mental fog, forgetting important appointments, consistently misplacing everyday items, or struggling to follow simple conversations that once came easily. This is rarely linked back to the medication until significant, perhaps irreversible damage has already occurred. Therefore, if you are currently taking oxybutynin and have noticed any cognitive changes whatsoever, it is crucial to understand that these are not imagined. You do not have to continue with this particular drug to maintain bladder control. Better, safer options exist. Fortunately, newer medications are available, such as mirabegron, marketed as Myrbetriq. This medication functions through an entirely different physiological pathway and has demonstrated significantly less impact on vital memory function. These newer drugs do not block acetylcholine at all and are generally considered much safer options for older adults requiring bladder control support. Don't sacrifice your memory for bladder control. Demand better for your brain. This is a critical discussion you must have with your healthcare provider now. At number 6, we address statins, a class of drugs that ranks among the most widely prescribed globally, particularly for individuals over 60 years of age. Their primary purpose is noble, to lower cholesterol levels and thereby reduce the devastating risk of heart attacks and strokes. Simvastatin, Zocor, and atorvastatin, Lipitor, are two of the most commonly prescribed versions. However, this is where a significant and dangerous problem emerges. Cholesterol is not merely a factor in heart health, it is an absolute, non-negotiable necessity for your brain's optimal function. Your brain is composed of nearly 60% fat, and cholesterol plays a critical role in the formation and maintenance of the myelin sheath, the protective coating that facilitates the smooth and efficient transmission of nerve signals throughout your brain. Without it, your brain's communication lines break down. When cholesterol levels are aggressively reduced by potent medications, there is a very real, terrifying risk of starving the brain of precisely what it needs to function optimally. Imagine cutting off the power supply to a supercomputer. Your brain simply cannot perform. A recent study found that seniors over 70 who had been on statins for more than 3 consecutive years exhibited a 26% higher risk of mild cognitive impairment. Furthermore, those on high-dose statins experienced even more pronounced and worrying declines in mental function. What is particularly alarming is that some patients have reported sudden onset memory loss, describing distressing instances where they were suddenly unable to recall familiar names, recent conversations, or even driving routes they had traversed faithfully for years. This isn't just forgetfulness, it's a terrifying blackout. It is important to note that not all statins impact the brain equally. Certain medications, such as pravastatin and rosuvastatin, do not cross the blood-brain barrier as readily and are considered significantly less risky in terms of cognitive side effects. If you have been on a statin for an extended period and are experiencing persistent mental fog, increasing forgetfulness, or growing confusion, it may be time for a serious, urgent discussion with your doctor regarding either a dose reduction or the exploration of alternative brain-sparing cholesterol management strategies. Delaying decisive action could lead to irreversible damage. The earlier you intervene and address this potential link, the better your prospects of preserving your cognitive health for the vibrant years to come. Your brain health must be prioritized over blanket cholesterol reduction. Our fifth medication category encompasses benzodiazepines, a class of drugs which includes commonly prescribed medications such as lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. These are among the most widely prescribed drugs in the United States for debilitating anxiety disorders and sleep disturbances. They function by enhancing the activity of GABA, your brain's natural calming neurotransmitter, which reduces overstimulation and nervous system activity. Initially, these medications can feel like lifesavers, quieting racing thoughts, alleviating panic attacks, and promoting much-needed sleep. However, over time, these drugs can tragically transform into a difficult-to-escape trap, robbing you of your cognitive vitality. A major study tracked over 8,000 seniors for a 6-year period and discovered that those who had used benzodiazepines for more than 3 months had a staggering 51% increased risk of developing Alzheimer's disease. The risk escalated even further for long-acting benzodiazepines like diazepam, which remain in the body for longer durations and accumulate in fatty tissues, including precious brain tissue. This insidious process leads to a form of chemical sedation that progressively slows neural activity throughout the brain. Consequently, your brain's ability to learn new information diminishes. It becomes less flexible, less efficient, and increasingly susceptible to debilitating confusion, dangerous memory gaps, and emotional numbness. Seniors regularly taking benzodiazepines often describe feeling as though they are moving through a perpetual fog, feeling disconnected from reality, or simply not feeling like their usual, vibrant selves. The most devastating aspect of this trap is the agonizing experience of attempting to discontinue the medication. Withdrawal symptoms, including severe anxiety, agitation, and debilitating insomnia, can be exceptionally brutal, creating a false sense of the drug's essentiality when it is, in fact, the primary source of the problem. Your brain has become physically dependent, not truly fixed. To address this dangerous situation, it is critical to follow a specific, expert-guided protocol. If you have been taking a benzodiazepine for more than a few weeks, under no circumstances should you stop abruptly. This can be genuinely dangerous and even life-threatening. Instead, collaborate closely with a knowledgeable healthcare provider to gradually taper the dosage down over weeks or even months. Safer alternatives, such as buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy tailored for insomnia and anxiety disorders, can help restore calm and peace without inducing progressive memory loss and cognitive decline. Your future clarity depends on this careful, deliberate action. At number 4, we find amitriptyline, sold under the brand name Elavil. Amitriptyline is an older tricyclic antidepressant that is still surprisingly and dangerously commonly prescribed today for chronic pain conditions, stubborn insomnia, and even migraine prevention. At first glance, It may appear to be a versatile, multi-purpose miracle pill that resolves several issues simultaneously. However, beneath this deceptive facade lies one of the most potent anticholinergic medications still in widespread circulation. It powerfully, mercilessly blocks the action of acetylcholine, the chemical messenger absolutely vital for neuronal communication, robust memory formation, and maintaining peak mental acuity. In fact, it inhibits acetylcholine so effectively that cognitive impairments are not merely possible side effects. They are essentially anticipated, tragically inevitable consequences of long-term use. A large-scale study meticulously examined over 3,400 adults aged 65 and older. The researchers discovered a terrifying correlation. Those who had taken higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. This is not a minor increase in risk. It represents more than half again the normal risk of losing your most precious cognitive abilities. What is particularly alarming is that the vast majority of these patients were never informed that this drug could actively, silently harm their memory function. They were often prescribed amitriptyline for sleep disturbances or nerve pain, and subsequently began to notice troubling changes such as short-term memory loss, difficulty finding words, and increasingly foggy concentration, symptoms cruelly mirroring early dementia. Serious problems do not even require a high dose. Even low-dose amitriptyline, taken nightly over several years, can silently erode brain power, presenting as a gradual decline that mimics normal aging but is, in reality, drug-induced cognitive impairment that could have been completely prevented. Therefore, if you or a loved one is currently taking amitriptyline, it is imperative to discuss safer alternatives with your physician immediately. For nerve pain, options such as duloxetine or gabapentin may offer comparable relief without the same level of severe anticholinergic burden. For sleep issues, melatonin or very low-dose trazodone, which has a significantly milder anticholinergic profile, can be used with substantially less risk. For mood support, newer antidepressants like sertraline or escitalopram are generally considered far safer for long-term brain health. Don't let a miracle pill steal your mental clarity. Demand a safer path. Coming in at number 3 is paroxetine, known by the brand name Paxil. Paroxetine is one of the most frequently prescribed selective serotonin reuptake inhibitors, SSRIs, for depression and anxiety disorders. At first impression, it appears to be a modern, sophisticated antidepressant, purportedly gentler and safer than older generations of psychiatric drugs. However, here lies a critical detail that is rarely, if ever, disclosed. Paroxetine is unique among SSRI medications in that it possesses significant anticholinergic properties, meaning it directly interferes with acetylcholine in the brain. This singular dangerous characteristic makes it drastically and fundamentally different from its SSRI counterparts like sertraline or escitalopram. A comprehensive review analyzed the cognitive profiles of elderly patients taking various SSRI antidepressants. The study revealed that paroxetine users exhibited measurable declines in short-term memory, verbal recall ability, and attention span within the very first 12 months of treatment. The research also found that seniors taking paroxetine were 30% more likely to display early warning signs of cognitive impairment compared to those on other common antidepressants. The cruel irony is that paroxetine is often prescribed precisely to stabilize mood and reduce anxiety, yet it ultimately undermines mental clarity and emotional regulation over time, effectively defeating its own purpose and leaving you feeling worse, not better, cognitively. The solution here is straightforward, yet absolutely crucial for your brain health. Avoid paroxetine entirely in seniors. The American Geriatric Society has officially listed paroxetine on its Beers criteria list, a carefully compiled compilation of medications that are potentially inappropriate for older adults due to serious safety concerns. If you are currently taking it, discuss switching to much safer alternatives such as sertraline or citalopram with your physician, as these are significantly better tolerated and do not carry the same serious cognitive risks. Furthermore, supplementing with B vitamins, particularly B12 and B6, can support mood naturally and may reduce your overall reliance on antidepressant medications. Do not let this hidden danger steal your peace of mind and your cognitive function. At number 2, we address antipsychotics. This category is particularly alarming and disturbing because many seniors are completely unaware they are even taking an antipsychotic medication. Drugs such as quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were initially developed and approved to treat severe psychiatric conditions like schizophrenia and bipolar disorder. However, they are now frequently and inappropriately prescribed off-label to elderly patients for common sleep problems, mild agitation, or behavioral changes tragically associated with dementia itself. This means that powerful drugs designed for severe psychiatric illness are now routinely administered in nursing homes and hospitals to seniors who are simply confused, restless, or deemed difficult to manage by staff. A chilling convenience for caretakers, a devastating blow to the patient. The consequences of this practice are profoundly, tragically devastating. A comprehensive study followed over 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within just 12 months, even if they had no prior history of dementia before starting the medication. Even more concerning, these dangerous drugs dramatically increase the risk of stroke, sudden cardiac death, and severe sedation, which can directly lead to dangerous falls, emergency hospitalizations, or permanent institutionalization in a nursing facility. This is a life-altering, often fatal, gamble with your cognitive and physical well-being. The mechanism behind this damage is brutal and direct. These medications aggressively suppress dopamine, a chemical intimately linked not only to mood and motivation, but also critically important for executive function and memory processing in the brain. When dopamine levels plummet significantly, the brain becomes sluggish, slow, and unresponsive to stimulation. This is precisely why seniors taking antipsychotics often appear dull, emotionally flat, or completely apathetic, their personalities fading away, leaving family members grieving for someone who is physically present but mentally and emotionally absent. This is a fate no one deserves. Correcting this tragic situation begins with asking direct and challenging questions. If you or a loved one is currently taking one of these potent medications, inquire with the prescribing physician about the rationale for its prescription and whether it is genuinely medically necessary or merely being used for convenience. In the vast majority of cases, behavioral symptoms can be effectively managed with non-pharmacological interventions, such as establishing structured daily routines, reducing environmental noise and overstimulation, addressing underlying pain or physical discomfort, and significantly improving lighting and sleep hygiene. When medications are absolutely necessary, using the lowest possible doses for the shortest possible durations can substantially mitigate harm. However, more often than not, these drugs are utilized for staff convenience rather than genuine medical necessity for the patient. The true tragedy is that many families are never informed about the actual devastating effects these drugs have on the brain. They simply witness their loved one rapidly declining without ever realizing the cause is chemical, not natural aging. Fight for clarity, fight for their minds. Our number one hidden danger, the one that is genuinely one of the most significant silent contributors to drug-induced dementia in the elderly population, is anticholinergic polypharmacy. You might have anticipated a single specific drug topping this list, a clear enemy to defeat. However, the most perilous medication scenario leading to rapid dementia in seniors is not an individual pill, but rather the silent, cumulative, and insidious effect of taking multiple medications with anticholinergic properties simultaneously. This dangerous, widespread situation is termed anticholinergic polypharmacy by medical professionals, a silent epidemic stealing minds. Imagine this all too common, heartbreaking scenario. A senior takes diphenhydramine nightly for sleep, oxybutynin daily for bladder control issues, and amitriptyline for chronic pain management. Each medication in isolation might cause only mild, barely noticeable memory problems. But when taken together, their effects exponentially compound and the cumulative anticholinergic burden on the brain skyrockets, overwhelming its delicate systems. This is not merely a theoretical concern or an academic worry. It is a terrifying reality. A comprehensive analysis tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years, more than double the normal risk. And here's the absolute worst part of this devastating situation. The vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications. No one had ever explained this profound danger to them. When acetylcholine, the brain's vital memory chemical, is blocked from multiple angles simultaneously, the brain doesn't just slow down temporarily. It begins to actively decay and deteriorate. Neurons physically wither from chronic underuse. Synapses, the crucial connections between brain cells, shrink and disappear, and the brain enters a hypoactive state that appears nearly identical to Alzheimer's disease on cognitive testing. This is not natural aging, it is a preventable, chemically induced decline. Rectifying this dangerous situation does not require a miracle cure or expensive experimental treatment. It simply necessitates a thorough and comprehensive medication review. A life-saving audit of what you're putting into your body. Ask your doctor or pharmacist to carefully evaluate your complete list of prescription medications, over-the-counter drugs, and even supplements for their anticholinergic load. Online tools and professional software programs are available that can precisely calculate your cumulative anticholinergic burden score, giving you a clear picture of your risk. Once problematic medications are identified, you can systematically work to deprescribe, slowly and safely tapering off unnecessary drugs, switching to safer alternatives whenever possible, and naturally rebalancing your brain chemistry. This is frankly the most empowering, hopeful aspect of this entire video. Drug-induced dementia is very often reversible when caught early enough. When the medication burden is lifted and removed, many seniors experience a dramatic regain of mental clarity, physical energy, and memory function within just weeks or months of discontinuing the problematic drugs. Your brain is remarkably resilient and capable of healing, but only if you give it a genuine opportunity by removing what is actively harming it. Polypharmacy is not just dangerous and harmful, it is completely preventable, and that makes it the #1 hidden medical threat to the minds of our entire aging population. Subscribe. Which advice will you start applying today?